You can come in. Hi, I'm Katie. I'm going to be your student nurse today.
Hi,
It's nice to meet you. What's your full name?
Brooke St. Ange,
And your date of birth?
9/12/97.
So that makes you about 20.
Yes.
And do you go to school or do you have a job?
I go to school at Posterior College.
Do you like Sawyer?
Yeah.
What's your major?
Nursing.
Do you find it stressful?
Sometimes, yeah.
Do you do anything to relieve your stress or?
I hang out with friends when I have time to.
That's good. And do you go to the dining hall to eat?
Yes.
Do you find that to be adequate nutrition?
Yep.
All right. And do you drink enough water daily?
Yep.
All right. And what brings you in today?
Just a general checkup.
All right. Well, you look like you're in good health. Your speech is good. And I noticed when you walked in, your gait was normal and symmetric. So before we start the head-to-toe assessment, I'm just going to ask you, are you in pain today?
No.
And if you were to rate your pain on a scale of 0 to 10, 0 being no pain at all and 10 being the most extreme pain you ever felt, what would you rate it?
A 0.
All right, good. So we're going to start off with your hands so I can just see them. Perfect. Your temperature is equal bilaterally. There's no moisture and your texture is smooth. There's no lesions present. I'm just going to flip them. Perfect. So I'm just going to check your capillary refill. All right, and it's under 3 seconds, which is normal. I'm just going to check your turgor, which is your elasticity of your skin. Perfect. That all looked good, so that's great. So now I'm going to move on to your head. So if you could just look down for me, I'm just going to feel around your head. So there's no lumps or bumps or anything. Your hair is evenly distributed. It's normal. It's thick. That's pretty much it for your head. It looks good. So now we're going to move on to your face. So we're going to test out cranial nerve 5 and 7. So if you could just smile for me, and then frown, and then raise your eyebrows. Close your eyes really tight and don't let me open them. Perfect. And now can you show me your teeth? And can you puff your cheeks out? Good. So I'm going to do sensation part of cranial nerve 7 towards the end of the neurological assessment at the end of the head-to-toe assessment. So now we're going to move on to your TMJ joint, which is your jaw. So if you could just bite for me. Perfect. And then just don't let me open your mouth when I push. Good. So that all looks good. So now we're going to move on to your eyes. And I'm just going to test your cranial nerve. So we're going to do confrontation. So if you could just stand up for me. All right. And then cover your left eye. Perfect. And then when you see my finger, say now.
Okay. Now. Now.
And then cover your other eye.
Now.
Now. Perfect. Everything looks good, so you can sit back down. So now I'm just going to check your pupils and see if they constrict evenly. So if you could just look forward. Perfect. Good. Good. They both constricted evenly, so that looks good. So now I'm going to do something called the 6 cardinal gaze. So if you could just follow my finger, but don't move your face. And then in. Perfect. So that looks good. So your eyes look good. Have you had any changes in your vision at all?
No.
And do you get regular eye exams?
Yep.
Okay, good. So now we're going to move on to your ears. I see that you have your ears pierced. Have you ever had any infections?
No.
All right. And have you had any changes in your hearing at all?
No.
All right. So I'm just going to feel them real quick if that's okay.
Mm-hmm.
Do you feel any tenderness when I touch you?
Nope.
All right. Your color is consistent in your ears too, so that's good. So I'm just going to have you close your eyes so we can test your hearing. And tell me when you hear the sound and which side you hear it on.
Now on the left side.
Okay.
And now on the right side.
Perfect. So your hearing looks good. So we're going to move on to your nose. So I see you have a nose piercing. Has that ever been infected at all?
No.
All right. So do you mind if I just touch your nose?
Sure.
Okay. Just checking if it's midline, which it is. All right. So have you had any changes in your scent or anything?
Nope.
All right. So because of that, we're not going to do a cranial nerve test. But however, I'm going to have you block one of your nostrils and breathe in and out.
Okay.
And then do it to the other side. Perfect. So that looks good. So because you had no change in your scent, again, we're not going to do a cranial nerve test. So now I'm going to move on to your mouth. Do you go to the dentist annually?
Yes.
Do you have any lesions that you notice or bleeding gums?
Nope.
Okay. So if you don't mind, I'm just going to look inside your mouth.
Okay.
So I'm just open up. All right. So your buccal mucosa is pink, which is good. Your gums are also pink. Your hard and soft palate look good, and your teeth look healthy. And then I'm just going to have you say ah.
Ah.
Perfect. So your uvula moved midline, which is normal, and I see that you still have your tonsils.
Yep.
Good. So that all looks good. Now we're just going to test some of your tongue functions. So could you say light, tight, dynamite?
Light, tight,
Out your tongue, and then move side to side. Perfect. So that was great. So now we're going to move on to your neck. Have you had any limitations in your range of motion in your neck?
No.
All right. Do you mind if I just feel that?
Sure.
There's no lumps or bumps. It feels symmetric, and your trachea is midline, which is good. So now I'm just going to do some cranial nerve tests for strength. So if you could push against my hands, and then push against my hand, and then this side. Perfect. So now I'm going to listen to your carotid and feel for it too. Perfect. 2+. Strong and normal. And consistent on that side too. It's 2+. So now I'm just going to listen to it with the bell of my stethoscope. Perfect. Everything sounded good. There was no sign of a bruising. I didn't feel any thrills. So now we're just going to do some range of motion with your neck.
Okay.
So if you could look up towards the sky, and then down towards the floor, and then touch both ears to each shoulder. Good. And then look over each shoulder. Perfect. So that's it with the front for right now. Now I'm going to move on to your lungs on the back side. Alright. So have you had any coughing or shortness of breath lately?
Nope.
Alright. So I just noticed that your thoracic cage is symmetric. Your skin doesn't appear to have any diaphoresis or edema. It looks smooth. And I'm just going to do something called symmetric expansion.
Okay.
Alright. So I'm going to put my hands on your back and just say, breathe in and out when I say now. Now. Perfect. Nice and symmetric. So was there any tenderness when I touched you at all?
No.
Alright. So we're going to move on to palpation. So tactile firmness. So when I put my hands down, can you say 99?
Sure. All right. 99. 99. 99.
I'm just going to move this up.
99. 99.
Perfect. So the vibrations were stronger towards the top, which is normal. So now I'm going to percuss you. So all you have to do is just sit tight. And I'm listening for resonance. If it was dull, that means there was fluid, which isn't good. But I hear resonance. I'm just going to lift this again. Perfect. So it was more resonant towards the top, and it got duller towards the bottom, which is normal. So now I'm just going to listen or auscultate your breath sound. So when I put the stethoscope down, if you could breathe in and out using your mouth.
Okay.
And if you get lightheaded or anything, just let me know and we can stop.
Okay.
Ready?
Yep.
Last one. Perfect. Everything sounded good. There's no adventitious sounds, which are just sounds that are abnormal. So now I'm going to move on to the front and do the same thing. So again, on the front side, you have some freckles, but that's normal. Your color is consistent. There's no diaphoresis or edema that I can see. And I'm just going to do symmetric expansion again. So put my hands on your stomach. And then can you breathe in and out when I say now? Now. Perfect, nice and symmetric. So now I'm going to palpate again. So if you could say 99.
99. 99. 99. 99. 99.
And then 2 more spots.
99. 99.
Perfect. So that sounded good. The vibrations are more towards the top, which is normal. So now I'm going to percuss you again.
Okay.
And then just one down here. Perfect. So it was nice and resonant. So now I'm just going to listen. And breathe in and out using your mouth again. And if you feel lightheaded, just let me know.
Okay.
And then one more down here. And one more to the side. Perfect. Again, no adventitious sound, so everything sounds good. So now we're going to move on to some range of motion and your upper extremities.
Okay.
So I could just look at them. Perfect. I'm just going to check your trigger. So your skin is nice and elastic. You still have some freckles, but they don't concern me. Your color is consistent. Your texture was smooth, and your temperature is equal bilaterally. So now we're going to do some range of motion. So if you could just put your arms all the way forward and then all the way back. And then put them up above your head. Perfect. And then put them up like you're going to have a fist. And then let me push against you. Don't let me. And then don't let me pull you. Good. So that was perfect. So now we're going to move on to, you can lay down. We're going to move on to your jugulars.
Okay.
Alright. So if you could look that way for me. Perfect. So I can see your internal and your external, and there's a little bit of pulsation. There's no distension, and they're flat. So if you could look this way for me. And again, I see your internal and your external. There's a little bit of pulsation. Alright. So we're going to move on to your cardiovascular system, which is your heart. So I'm just going to feel around your precordium for any heaves or abnormal pulsations. Everything feels alright, so I'm just going to look for a pulsation on the top of your chest. And I see it, which is also normal. So now I'm going to feel for your apical pulse.
Okay.
And after, I'm going to listen to a full minute. So just hang tight. And I feel it right about there. It's a 2+, strong and normal. So now I'm just going to listen for a minute. Perfect. So it's about 70 beats per minute, which is normal. It's within the normal range. So now I'm going to listen to the rest of your heart, and I'm going to start at the aortic valve on the second intercostal space on the right side.
Okay.
Now I'm going to move on to the pulmonic valve, which is the second intercostal space on the left side. And then I'm going to move on to Erb's point, which is a love and the dove sound on the third intercostal space on the left side. Perfect. Now I'm going to move on to the tricuspid valve, which is the fifth intercostal space on the left side. And that sounds good. So I'm going to move on to the mitral valve, which is also where your apical pulse was, which is the fifth intercostal space, midclavicular line on the left side. And that sounds good. So everything sounded good. There was no brewy or anything like that. So we're going to move on to your abdomen. Your abdomen looks flat. Temperature is equal bilaterally. Your color is consistent. Your skin is smooth. I noticed you have a belly button ring.
Mm-hmm.
Has it ever been infected?
No.
All right. And your belly button is midline, which is normal. And I'm just going to feel for your aortic pulse.
Okay.
And just listen to it real quick. I feel it about there, and it's a 2+ and strong. After I listen to your aortic pulse, I'm just going to move right along to listening to your bowel sounds.
Okay.
Perfect, so that sounds good. So I'm going to move on to your bowel sounds. Perfect. So your bowel sounds were within 5 to 30, which is normal for a full minute. So that's it for your abdomen. Actually, no, it's not. Sorry. I'm going to percuss your abdomen, so I'm listening for tympany.
Okay.
Perfect. That sounds normal. And now I'm just going to palpate.
Okay.
So are you ticklish at all?
No.
Okay. So I'm just going to lightly palpate first to feel for any lumps or bumps. Perfect. Now I'm just going to deeply palpate. So if you get ticklish, just let me know. We can put your hand under mine.
Okay.
That's where your liver would be, right here. And then your spleen would be over here. Perfect. So I didn't feel any lumps or bumps. So now I'm actually done with the abdomen, and we're going to move on to your lower extremities. So again, I noticed when you walk in, you were symmetric. Your legs are symmetric. Your hair is evenly distributed. Your color is consistent. Your temperature is equal bilaterally, and your skin is smooth. So I'm just going to check you for pretibial edema.
Okay.
So that seems good. So now we're going to move on to your pulses. So I'm going to check your posterior tibialis on both sides. Perfect. They're both a 2+, strong and normal. Then I'm going to check your dorsalis pedis, which is on your foot. Perfect. That's also a 2+, strong and normal. So I'm just going to check your capillary refill real quick on your toes. Good. They're both under 3 seconds, which is normal. So now I'm going to do some range of motion with your lower extremities.
Okay.
So if you could just extend your leg all the way up in the air straight. And then your other leg. Perfect. And then bend your knee and bring it up towards your stomach. Good. And then bend your other knee, bring it up towards your stomach. Perfect. And then could you swing your leg out? And then swing your other leg out. Perfect. That all looks good. So I'm just going to check your turgor on your feet. Good, nice and elastic, so you can sit up now. Alright, so I'm just going to have you swing your legs in and out. Perfect, and now can you swing them towards resistance? And then don't let me pull. Good. So then, can you point your ankles towards the ground, and then point them up, point them outward, and inward, and wiggle your toes. Perfect. So can you do that against resistance, just pushing up? And then pushing down. Good, so that looks good. So your range of motion looks good. So now we're going to move on to your last neurological assessment. Alright. So I'm just going to do sensation throughout your whole body. So if you could close your eyes, and when you feel the cotton ball, say now.
Okay. Now. 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 Now.
Perfect. So your sensation looks good, so there's no need for a sharp or dull test if you could feel the cotton ball. So we have one last assessment, which is the finger to nose test.
Okay.
And if you could just put your finger to your nose, and then touch my finger, and put your finger to your nose and touch my finger, and again, and again. And I'm actually just going to have you lie back down real quickly to do one more neurological assessment.
Okay.
Alright. Could you just put your heel to your knee and rake it down your shin? Perfect. And then your other heel to your knee, rake it down your shin. Good. So you can sit down now. Thank you. And that was the full head to toe assessment. Thank you for your time, and the doctor will be in soon.
Okay.